Welcome to this week's Biomechanics Q&A live from Instagram. We haven't gone live on Facebook yet. Who wants to talk about multitasking? Over on Zoom, if anybody wants to chat away and use the chat box, Amelia over there. We'll just let Facebook kick in, Instagram, just see if anyone comes along there. And as you can see, the hair salon is is what I'm waiting for now. So I washed my hair and I've still got roots, so I thought I'm going to cover it up with a hat. So how are we doing, guys? There is light at the end of the tunnel, as we know. Hello there, Joanne. How are you doing? And this week we've got some amazing questions. So you've probably seen from the title. One of them, the first one we're going to talk around is, do asymmetries cause pain? There are a couple of questions that go on from that, and so as usual I've done my research, so thank you to the people who post the questions in. It's really helping my learning, and this week is super relevant actually to what I've been studying with movement therapy education as well. So Gary, how you doing? Leanne, hi there. Michelle, how you doing? HC_sports massage, how you doing? So I'm going to run through the questions, then we'll run through responses, and then at the end, obviously there's going to be resources and so on. Hi there, Andy. Just let a few more people check in. We've still got a minute before we start. And again, as always, in any of these Q&As, you can post at any time. Instagram is slightly harder. I have to come over and have a look. Zoom, you can obviously post any time. Facebook, I think Stevie's just posted. Oh, I'm on my big screen. Are we taking up the whole screen, Stevie? Screenshot over on Facebook. So, okay. Got a few more. Corianne, Alistair, amazing. So we've got more joining in on Instagram. Okay, so we're going to kick off. I've got a few over on Facebook. Let me know who you are, just so I know who I'm talking to. That always helps. So, great questions. Really awesome questions. Do asymmetries cause pain? Well, yes and no. So, it's a massive question. And what you'll see that I use as kind of almost like the intro every week to this session is great questions will result in great answers. And I've just initiated my sports therapy diploma, movement therapy education diploma. And the first module is about referencing and understanding research, doing your own research, reading research, interpreting research. And literally the modules that I've started looking at are going to help me guide you on finding solutions, maybe not answers, but solutions to your questions. So let me explain. So first of all, let's talk about, let's dissect the question. Do asymmetries cause pain? So asymmetrical means if you were to dissect the body down the center and look at it half and half. Sometimes in bodybuilding you talk about symmetry between upper body, lower body in terms of aesthetics. We might talk about it in terms of the skeletal system, or we might talk about it in terms of dysfunction and differences in soft tissue. So an asymmetry is when you might see somebody, and I think, and I'm going to assume just for a minute, that this question relates to, because of its subsequent questions, a structural asymmetry. So if you imagine someone with scoliosis may or may not present with a shoulder higher on one side than the other, is one example of an asymmetry. However, somebody with a functional asymmetry has a tight QL or overactive QL, and then their upper tract, this side, presents with the same asymmetry visually, but that's a functional asymmetry, not a structural asymmetry. Now, I know this individual who's asked the question does go on to talk about structural asymmetry, so I'm assuming that's what she's talking about, just to give you, the audience, a kind of a broader scope on what we're talking about here. Do asymmetries cause pain? So it's understanding what the asymmetry is, what it's caused by, and then also understanding pain. So she's just dropped in as well, Susan. We've just gone through the definition of asymmetry, both functional and structural. And then when we look at pain and what pain is, we've done this on previous Q&As. Pain is an alarm signal. So pain is a good thing. It's telling you something needs to change. If asymmetry is causing the pain, which is the question, then that alarm signal is likely being triggered because the body is feeling unbalanced and there is risk. If that asymmetry is structural and causing pain, we're thinking that the asymmetry is causing the pain, then interventions like orthoses may be used. And again, it depends on the degree of asymmetry, the amount of pain, how much quality of life has been lost. So there's a lot we need to pick out of this question. So, original question, do asymmetries cause pain? Yes and no. So we need to understand the asymmetry and we need to understand the pain better first before we put them together. And I think one of the problems out there at the moment for us as therapists, even for the clinicians, but as movement professionals as well, is assuming the pain is caused by the asymmetry, and that may not be the case. So there are instances where individuals have gone in and they've had MRIs, they've had anomalies seen, or asymmetries if you like. Surgery has been done because the individual has been in pain, and obviously a lot of pain. To go through surgery is pretty intrusive. And then when they've come out, the pain has not gone away. So the pain has still been there, even though the asymmetry or the intrinsic issue has been removed, the pain is still there. So we need to really understand what the asymmetry is, what's causing it, how definite can we be about that? Is there an X-ray? Is there an MRI? Then the pain, is it affecting quality of life? Are there other things we can do in advance of more intrusive interventions to understand causes of pain? Is it cognitive? Is it residual? We talked previously about how pain functions, so the pain sites, which I know Susan, who asked the question, has already looked at. So really, for those watching this who maybe had the same question, or you're watching because you thought, oh, that's a good question, do asymmetries cause pain? Both. And until we've understood the question at a deeper level, it would be impossible to answer. So that's the first question, and that initially would be my first response. If there's pain, we need to change something. That is why you have pain. The body is great at telling us something needs to change, but we need to understand risk, quality of life, and all of that in place. If it's structural, then chances are you can't change it. But is the structural asymmetry actually causing the pain, would be the question. So let's look at the next question, because they do kind of tie together. And so if at a skeletal level we are asymmetrical, how important is it at a more superficial level? So it's a very interesting question. But again, if we dissect the question, it's a bit too ambiguous to be able to just answer that question. So if at a skeletal level, so let's take scoliosis as the example. So somebody is scoliotic and they were born like that, then that is how they present, can't change it. The second half of the question asks, how important is it at a more superficial level? So importance is, again, it's going to be subjective. So is the importance based on aesthetics? So when we talk about a superficial level, that's another question. How superficial? Do you mean on how they look? Or is it actually how they feel? I'm just going to check if there's any more questions going in, Susan, if you want to elaborate any further on that. So the question, if at a skeletal level we are asymmetrical, how important is it at a superficial level? I have no idea. It depends on what you create, what you define as important. Is it purely aesthetic? And how important is that to the individual? So there's some asymmetries, scoliotic people I know, they don't care. you know, they're fine as long as they can move and have a quality of life and don't hurt too much. Superficial level is the other part of the question. Superficial, does that mean just on visual, or superficial as in skin surface or muscle tone, the way that we strength train them? So I need to know more information again to be able to really answer the question. So the question is the bit I'm really going to start taking this Q&A towards, is to understand the question first. So then the third question is, what does the research say about what? Because in research, if any of you study research, and this is the part of my learning that I'm in the depths of right now, is understanding how to find good research, good sources, how to then interpret what's been said, and then how to understand, is that a good, valid, reliable piece of research? Is that backed by good data? And so that's really where I want to take this blog, to help the individual who asks the questions to really find solutions, maybe not answers, but certainly solutions. So to ask a question, what does the research say, without stating specifically the question, that's what makes it ambiguous. So the two previous questions, as I've explained, are too ambiguous, too broad. Does asymmetry cause pain? And does skeletal asymmetry, how important is that on a superficial level? So those two questions are too ambiguous. There's too much scope. There's too many more questions that we need to ask to identify what is the problem, what solution are you trying to find, what are the answers you're truly seeking. So I'm just going to stop for a moment. So the person who asked the question says, about these questions, more geared towards preoccupation Pilates teachers may have with alignment. Okay. Perhaps it is a better question to ask, does pain cause asymmetry? Okay, so let's flip it that way around. Let's do the second part of that first. Does pain cause asymmetry? Again, it depends. It might do, it might not. If you hurt and it's down one side of the body, let's say the lower limb or the knee is sore, that may create a limp, because when you put the load onto that leg, it hurts. When you take the load off it, it doesn't hurt so much. So again, it would be a difficult one to translate, I'm afraid. Like the previous one, you could switch it either way around. There are too many additional details that are required. So let me take this further, just to try and help with the way I want to try and respond, particularly on social media, where I have no idea who many of you guys are. I don't know your training. I don't know how you're going to interpret everything I'm saying. So while this individual is trying to find solutions, we do need to delve deeper to be accurate and to be able to answer. Otherwise, it will be a generic answer as well. So let's just try and help the question along a little bit. Because and let me talk about research, which is the third part of the question. What does the research say? Well, it depends on what problem you're faced with and what you're trying to find out. So research is guided to be able to give us valid and reliable data. And to do that, it needs to be very specific. So if you go and put into an internet search bar a question, you'll get, and if it's something like, do asymmetries cause pain? And I did this, by the way, Susan, just to let you know. And let me just give you some of the titles of the research papers that came up when I typed, do asymmetries cause pain? Just to give you an example of what I'm trying to explain here. So the responses I got to that, just in a general internet search bar, was low back pain study, systematic review of spine degeneration in asymptomatic populations. Another one was the association between pelvic asymmetry and non-specific chronic low back pain as assessed by the global postural system. And I need to cite all of these as well, because they're all on there. Effective pelvic asymmetry on low back pain on trunk kinematics during sitting a comparison with standing. Fluctuating asymmetries and low back pain. So what you can see is the questions when you look at research become very specific. There's a reason for that. Because to be able to answer strongly to a question or to have a good response to a question, the question needs to be really, really specific. So these questions are really specific or they're far more specific in terms of trying to understand how we can do a piece of research to understand, do asymmetries cause pain? Because that question is not deep enough. It doesn't clarify things like, and this is how good research is kind of formed. You need the question to be super specific to begin with. You need to understand what population is it? Is there an age group? Is it elderly? Is it people in pain? Is it people with asymmetries? Is it people with both? What intervention maybe, depending on what you're the problem you're trying to solve. What are the controls? So do you have a group that don't have those kind of symptoms or things going on to do the same tests on to see whether there is a comparison to know if it is that asymmetry causing that pain? And then what's the outcome of all of this? So you can see how you need to kind of refine everything. Within a research study, you can have dependent and independent variables. A dependent variable relies on the data around the study that can change or not change. So you're trying to look at a lot of detail. If you're using, I think the example on Mike's course was a cuff to measure things, and so the diameter of the cuff or the measurement of the cuff, if that was to change, would it change the result? And also having what do you call it? Qualitative and quantitative studies. So a quantitative study would be something that has more objective measurements within it, like diameters of equipment, whereas a qualitative study is more subjective, where you're asking the opinion of the subject and how they perceive what's been going on. So it all sounds very complicated, but when a question gets asked, and we can certainly talk about this privately, Susan, if needed, but it's not enough to simply ask the question, do asymmetries cause pain? And this is why very often when I get asked questions on social media, why I do these Q&As is, it's often not the question that gets asked that I end up answering, it's how to ask a better question to find the solution you're seeking out, rather than simply an answer to the question. An answer to the question is not enough. If I answered the question, it would just be yes or no, yes and no, because there's probably cases of both if you look at the research. And the research is very specific, so actually does that answer the question that's being asked? So I'm saying quite a bit here, and I know I'm just waiting to see if there's any more questions. So Susan asked, more geared towards preoccupied Pilates teachers, preoccupation Pilates teachers. So again, this is being generic, and you can't be to find the answer to a question. You have to specify to really get a good answer. So this is why my header is, if you ask a great question, you'll get a great answer. If the question is not good enough or needs more detail, I'll just have to ask more questions and talk around the subject rather than be able to answer it. And I'm not that arrogant anyway that I can answer all questions. I can certainly signpost you. So let me just check out. I'm just going to go back and see if there's any questions come through. Instagram gang, Rob, Richie, hi. Whole bunch of guys in there. I can't say all your names because there's so many of you, but hello guys over there. So feel free to ask a question. So let's go backwards to come forwards again. It may be that you have how is this useful? How is this useful to you? How is this useful to the person who's asked the question? The person who's asked the question, I would go back to and say, I need more detail. So if a client came into you and said, does my asymmetry cause my pain? What would you say to them? Have a think about that just for a second. A client comes in and says, Does my wonky back cause my pain? What would you say? Think about it for a minute. The first thing you'd probably do is do a consultation. You'd say, I need to ask you more questions. Yeah. You would need to understand, is it structural, is it functional? How long have you had the pain? How bad is the pain? Where is the pain? You'd be writing all these notes. You might do some physical assessment. So Susan would do a biomechanics assessment, having done the biomechanics coach diploma. So you'd assess the QL, you'd assess the pelvis function, how well the spine moves, where, you'd understand a bit about pain science, how high is it? Is it a red flag? Should we be sending for a clinical analysis? So if somebody came in and said, do asymmetries cause pain? We wouldn't have an immediate response. Yeah. Maybe the same if we go back to the second question. A client comes in and says, I have an asymmetry, a skeletal asymmetry. We would want to understand for them, and this is the second part of the question, how important is it at a more superficial level? What's important to you? And to understand the question better, I need to understand what a superficial level means. So is that on top of the skeleton, i.e. the muscles, the tissues, etc., or is it literally how you look? So does it bother you that you walk around with one shoulder higher than the other? Some people will be like, no, I'm not bothered. Or it may be quite subtle. Others, if they're very round shouldered, they may feel that they feel really like they look miserable all the time. So that's affecting their quality of life because people keep saying, are you all right? You look really sad, or, So it's trying to understand the effect of that asymmetry, how important it is. So again, we need to ask more questions. And then again, the final question, what does the research say? To understand research, what it's telling you, you'll see on all good research papers, valid research papers, the question is really specific. So if you're not, if you've not previously been trained in reading research, but you have a play around on the internet, you will find both valid and maybe unvalid, maybe research that's on a website or an article. So I write articles, they're based on my opinion and my bias. Whereas a peer-reviewed, solid, valid, reliable PubMed, journal, the question will always be really very, very specific. So I'm going to pause again just to see if any more questions. Susan, she's dipped out, so maybe a techie issue, to just come back and see if anybody else has more questions. So Stevie, I know that if you're still there over on Facebook, you are still, you're doing movement therapies education's diploma as well, aren't you? So any of your thoughts on that, anything I've said, anything to add to this in terms of looking at research? So I'm going to look over on, hi there Silk, Mags, how you doing? Hello Manish, how you doing? Oh, thank you. You too, dude. Check if there's any questions over on Instagram. Okay. So really that's a relatively short one this week in terms of the questions, how I would then answer those, which is, I would need to ask further questions. But certainly for you, if you have a client coming in to your studio or your clinic, yeah, good, thanks, Max. Then really, if they're coming in and saying, is my asymmetry causing my pain? We need to know a full history. We wouldn't work with a client until we've done a full consultation, we've ruled out or in red flags, we've either signposted them away to be cleared back to us, we've got them to sign a document that talks about, have you got any medical conditions, any history, any surgeries. Hi there, Izzy. Sorry, we're coming to a close, I think. Not sure how long you've been in. We would want to know if they've got any previous MRI scans, reports, any imaging, those kind of things, before we even consider then going through maybe a physical assessment. The physical assessment may show asymmetries. In fact, that's an area I can go into. Again, just reminding me on Mike's learn anatomy stuff. Right, okay, thanks, Stevie. Okay, cool. So just to kind of like, just to go on to a further point maybe about asymmetry, which might be interesting for some of you, is when you look at cadavers, so if you ever have the ability or the opportunity rather to access a cadaver lab and really look at bodies of people who volunteered their body, their cadaver, after their death for us to study, which is a real honour, by the way, and quite humbling when you enter a cadaver lab. Not necessarily for a direct dissection. You can go in and simply evaluate something that's already been dissected and embalmed and dissected, and look at a single individual's. Let me give you an example. ASIS, so the bony prominence on the front of your hip. And if you were to measure that, or the PSIS around the back, so you anterior superior iliac spine and your posterior superior iliac spine, because they are either end of the iliac spine. The one at the front is anterior, the one at the back is posterior. And what you can see on a single individual is they have different sizes and shapes, even just a simple landmark like that. And this is a landmark that is used to do biomechanical assessments. So if somebody does an assessment on the tilt of your pelvis, for example, which is a common subject, it's a hot subject, is anterior tilt. Which means that the pelvis is tilted forward. So the ASIS is lower at the front and the PSIS is higher at the back, which is a basic movement that we are capable of, and that's how we walk. Is the ASIS will drop at the front as the leg steps back, and it will rise again as the leg steps forwards. That's what happens normally. So your pelvis will both anteriorly and posteriorly tilt through movement. One of the diagnoses that is often given is you have an anterior tilt. And that measurement is based on the position of the ASIS and the PSIS. Now, one of the issues in that is if your ASIS, PSIS from one side to the other is a different length, it can give the appearance of an anatomical sort of tilt. And then it's a subjective, it becomes problematic. So it isn't an accurate measure of having an anterior tilt. Having an anterior tilt really isn't a diagnosis. It shouldn't be a diagnosis. It's simply a position of the pelvis. If somebody is excessively lordotic and has back pain, we would then want to understand the cause, which is why these kind of tests are done. The problem is that many tests out there do use bony landmarks, and individuals can have very often actually asymmetries. So I don't know if you've ever done it, but have a feel of your own body. Have a feel of your own acromion process. Does it feel the same? Is it the same length on one side as the other side? Is the shape the same? Is the hill the same? An easier one might be your medial malleolus. So the bottom of your tibia, the shin bone comes down. If you come onto the medial aspect, you have a medial malleolus, which is the bump on the inside of the ankle. And if you feel that bump in your body at the same time on one side as the other, you may feel a difference. You might not. You could do the same on the outside. You could feel there and see if there's a difference. And one of the common things clients then says, oh yeah, I've got my hips feel wonky, or my shoulders feel wonky, or something. I can feel it. It's different on one side. But that may just be your design. It's like, have you ever put a mirror in the middle of your face and had a look? Or when you look at yourself in reverse and you look odd because you have natural asymmetries within your own physicality that is totally normal for you. So being different is normal. And this is where, again, looking at asymmetries and levels and positions and joint designs, and as you age, your asymmetries may begin to exaggerate through to biomechanical loadings. So if somebody has a functional leg length discrepancy because the tissue on the hip adapts, the QL adapts because you carry a bag on one side all the time, and then over time that starts to create a functional issue that if we don't eradicate that, that then means that the body is moving upon structures that are loaded asymmetrically, and the normal natural wear of the body is asymmetrical. So then what happens is we develop more structural asymmetries over time, like sclerosis in the hip, bunions in the hallux or the big toe, the ball of the big toe, which I have on one side, which you don't have at birth, can form because you've had a biomechanical load over time. So these asymmetries, again, they may result in pain, they may not. So what should we do about it? Well, we want to find out, what it is, if we can, what's causing it maybe, is it functional, is it structural? Is there a discomfort that seems to go with it, trying not to assume it does? How can we create improved movement and function in a safe manner with all the right protocols in place, and then therefore see whether this discomfort starts to dissipate, rather than I hurt here, rub here, test here, move here, oh it's higher than that side, it must be the asymmetry. And I think we've got to be careful about these kind of assumptions. So we shouldn't ever assume anything, other than the worst. But maybe not. Let me reword that. We don't assume anything. We assess, we question, we evaluate, and then we keep doing that as we monitor our client's progress, which I know you will all do already. That's part of your training. Stevie says, asymmetry 100%. We need to get their story before we look at or think about anything. Yeah, no problem, Izzy. So it really is trying to understand the client, the SMART goal. So if you remember back in your original training, I'm quite confident if you're a movement practitioner or a therapist, you will have been trained in how to create a SMART goal. A SMART goal is almost like a research question. So if you take SMART goaling and then look at research questions, the research question is really specific to try and result in a conclusion. Like a SMART goal, you're trying to result in a very specific adaptation. So we try and help clients create SMART goals so that we know the point at which we're aiming for is realistic, it's specific, we can measure it, it's in a certain time span that we feel is appropriate, and if not, we can help them to develop one that is. Research has a very specific criteria in the title. The question is, the good research rather, there's some that's not so good. A good research question will certainly be really specific to allow the researcher to develop control groups, parameters, specifics to give a really good result. And this is what our practice should be based on, is evidence-based. And evidence-based means good, valid, reliable, peer-reviewed, solid data from research that has a purpose. It's novel, it's interesting, it helps us solve problems maybe, to understand the data that's coming in from the research, filters down to us as individuals to then help our clients. So that went on a bit, didn't it? Since I was finishing about 10 minutes ago. Just come back in, just check if there's any more questions. Hi there, Claire. Hi there, Kaiser. Just a few more. Lucy. How are you doing, Lucy? Okay. So I'm going to start to bring this to a close. I'm just going to pause and see if any more questions come in. Otherwise, remember that all of these Q&As through the whole of lockdown since last March are over on the Biomechanics Education YouTube channel. You can go and watch those. They're free at the moment. They're all free on there. So, fill your boots. We've covered all sorts of subjects, movement related, pain science, specific questions around client problems. And today I hope was insightful when we have these kind of generic questions. Oh, I wonder if asymmetries cause pain. It usually comes from a situation, like a really specific question based on a client came in with a complaint or a problem. We have that generic question then, I wonder how much structure or asymmetry causes pain, but you really have to funnel it back down to have a really good question, just like great research. Ta-da! Say hi, Broxy. Say bye, Broxy. Okay, that's it for today, guys. I'm going to let you go. Listen, stay safe. You know where I am. If any of you want to learn any of our techniques, obviously the biomechanics.education.com website is full of CPDs. There's free ones, there's really cheap ones, £7. And there's a load of anatomy stuff in there, right up to our full diploma in biomechanics coaching. If you're interested, ping me a message. Have a great day. Thanks for coming. Please share. Or don't forget the Facebook page, Biomechanics Education. Sorry, not Biomechanics Education, Biomechanics Q&A. You're welcome, Charlie. You're welcome. Take care. Instagram. See you soon. See you, Facebook. See you, Zoom.